Hi, guys. I am thrilled to be back here with you today with Dr. Ana Rodriguez and Dr. Sonia Malani to have a really important, life-changing conversation about integrative and naturopathic oncology. If you or someone you love has cancer, you have to listen to today's episode. You're going to be uplifted, you're going to be hopeful, you're going to be inspired. And I'm so thrilled and honored to be here with these two amazing clinicians today. Dr. Ana, you have known Dr. Malani for a really long time. I'm going to let you start us off with the questions for her.
Awesome. So, Dr. Malani, you are one of 120 board certified naturopathic oncologists in the world. Can you tell us more about naturopathic oncology and what it is that you do?
Yes, absolutely. Okay. Hi, everyone. I'm Dr. Sonia Malani. I'm so grateful to be here with Dr. Kate and Dr. Ana, two of my favorite docs in the world. So I am a board certified naturopathic oncologist. And what that means is I've done extensive training beyond my 4 years of medical school to specialize in the field of integrative oncology. So what is integrative oncology? This field is really meant to focus on how do we bring the best of both conventional oncology, so we're talking chemo, surgery, radiation, with the best of naturopathic oncology. So we're talking diet, lifestyle, herbs, IV therapy, nutrition, exercise, to bring the best outcomes for our patients. So what we're hopeful as naturopathic and integrative oncologists, our hope is to increase overall survival and disease-free survival for all of our patients.
Amazing, world changing. So what you're saying is folks don't have to choose. They can talk to you about everything and you can advise them about everything. Can you talk a little bit more about that?
Yeah, absolutely. Yeah. So my goal, I'll just say, I'll say really quickly that my entry point into this field was very personal. I've had two family members, two parents, both been diagnosed with cancer. My mom was diagnosed with stage 3 breast cancer, and my father was diagnosed with stage 4 gastric cancer. And I've been to countless doctor's visits with them, countless oncologist visits, sitting, across the desk from the oncologist, trying to extract as much information out of this doc, right? And what I've found is that there's just not very many docs are well versed in both naturopathic medicine and conventional medicine. And so that was my goal going through school and going through training, was how can I really be the bridge to both of those worlds? So we're all board certified naturopathic oncologists are really well versed in the standards of care. So, we all know all of the chemotherapies, their side effects, their half-lives, all of that, as well as the options for surgery, what the recovery times look like, and as well as radiation. How can we enhance radiation? How can, if we need to, maybe put radiation off if it's not necessary. So, yes. And then alongside that, we're trained in the diet, the supplements, the herbs, all of that to increase quality of life during treatment, which is incredibly important. One thing that happens quite often is patients become so sick from their treatment, something like chemo, that they're not able to continue and finish all of their chemotherapy. And what we can do is make sure that while you're going through chemotherapy, your quality of life stays the same, so that you're able to get through all of those rounds and come out and not be completely depleted.
That's beautiful. So talk to us a little bit about, I think people are familiar with surgery, chemo. They might be new to it, but it's things that they've heard of and that they understand are sort of standard of care when someone has cancer. What are the standard of care, or sort of like the toolkit that a naturopathic oncologist would also be including or talking to clients about? Can you give us some examples?
Yeah, absolutely. So a great example is, many people know someone that's been diagnosed with breast cancer. A common standard of care treatment for a breast cancer patient is 4 cycles of a chemotherapy called AC, adriamycin and Cytoxan, usually followed by Taxol. So it's the acronym is ACT. And then there might be surgery before that or after that, depending on, the stage and the location of the tumor. And sometimes, depending on the combination of the surgery, you might need radiation as well. So if that is the course that we're looking at, for the next few months, we have chemo, we have surgery, and potentially radiation as well. What I come in and do is help bolster you through chemo. So increase quality of life, decrease side effects. Those are my goals. There might be some supplements, there might be some diet, there might be some, exercise recommendations that we make. And then during surgery, we have some protocols to help you decrease your recovery time, make sure that your bowels get going again after surgery, make sure that we decrease the amount of scar tissue that's about to be built, make sure that we have PT on board and everyone else to increase your range of motion if you're getting some surgery in your axillary region or underneath your armpit. And then during radiation, there's some really wonderful natural medicines that act as what we call radiosensitizers. So they help enhance the effect of radiation to the areas that need it.
Wow. Okay. So this sounds amazing. What I want to take a minute to say to the folks at home is some of you that I've talked to, because I refer to Dr. Malani a lot, right? You guys know this. Anybody who comes to my practice, if you or a family member has cancer, I'm sending you to Dr. Malani. And that is because as amazing as people like Dr. Anna and I are, who are naturopathic doctors, Dr. Anna also has her traditional Chinese medicine acupuncture training. We are not trained in oncology. And that is a very big deal because that training takes a very long time. It's highly specialized. You hear Dr. Malani sort of rattling off all these standard protocols, right, for treating breast cancer. That's important because supplements, foods, the things you do with your lifestyle can either enhance or interact with the other things you're doing for your cancer. You need someone who's specialized, who knows those things. It truly is a specialty that you have to study for years. This is not something you just learn off of the internet. So Dr. Malani has put in a lot of time, a lot of years of studying this and is certified, which is a pretty intense process to get certified. Can you tell everyone about your certification and just briefly what that entails beyond a medical degree? Yeah.
Yeah. So you'll see this alphabet soup after my last name, and the 5 letters are FABNO, which stands for the Fellow of the American Board of Naturopathic Oncology. So there's an association called the ABNO, the American Board of Naturopathic Oncology, that has a board certification for naturopaths that want to do further training. Right now, there's 2 routes to get this board certification. You can either do a 2-year accredited residency, which is what I did, or you can be in practice for a certain number of years, see a certain number of patients, and apply that way. So yes, it's a rigorous training, and I studied both in hospitals. So I rotated with medical oncologists, surgical oncologists, radiation oncologists, as well as naturopathic oncologists. And so that is the reason why we're able to speak both languages. I've spent time in the hospital, I've spent time in outpatient clinics, and I'm also a cancer researcher. So I spend a lot of time doing prospective outcome studies, looking at every single outcome of every single patient that I treat. So I want to make sure that my patients and the patients that are being seen by naturopathic oncologists are doing better than standard of care. If we're getting the same the same outcomes as standard of care, then really what we're doing is just kind of expensive and excessive and stressful, right? But the reason why I think this field is so important is because we can show that our outcomes do surpass standards of care. And therefore, the time that you're spending with me, the money that you're spending on supplements, the time that you're spending cooking yourself more nutritious food does actually pay off. And we can show that from research.
It's such a relief. I feel like a lot of what Dr. Anna and I hear people talk about when they get a diagnosis or their loved one gets a diagnosis is the absolute, just like first the shock, right? And all the stages that you go through of that, and then feeling really lost.
Wow.
And can you talk to people a little bit about what you do in an appointment? So say somebody from Pennsylvania calls you and they're like, I just got diagnosed. I have a great team who's doing the traditional stuff, but I want to know everything I can be doing. How would that process look with you?
Yeah. So my first visit is usually 75 minutes. Before that, I like to get my hands on pathology reports and, if they have surgical pathology reports or biopsy reports or recent labs, I'd love to get my hands on records beforehand so that I can make sure that I'm really well-versed in your diagnosis. And that way we can use the entire 75 minutes, not catching up about the diagnosis, but coming up with a plan of action together. And so, we look at what the next few months are going to look like in terms of treatment options. There's definitely some treatment discussions that we can have. We do try to prevent over-treatment. So for precancerous lesions or stage 0 or stage 1, there are, certain situations where the research shows that maybe less treatment might be better. And that's a very nuanced conversation that is important to have. But otherwise, we look at what your treatment protocols are going to be and then figure out how we can help support you. Dr. Kate, your point of this being a really kind of emotionally taxing diagnosis is also a huge part of our visit. I think when people are diagnosed with cancer, or, it's like this big C word, this big scary C word, there's never really a moment between the diagnosis and the action steps of treatment where the patient can sit down and exhale and take a moment to realize what they're about to go through. And so I try to use my visits as that as well. Like, let's get off the cancer conveyor belt for a moment. Let's zoom out. Let's look at really how this is going to impact the next few months of your life. And not only next few months, but, the rest of your life, really. And let's come up with a plan of action together. I think it's really important too, that while the person is going through treatment, they have people like you, Dr. Kate, and you, Dr. Anna, to help support other pieces, right? So like helping support their GI, going through acupuncture, all of these things, to make sure that while they're going to treatment, they don't come out sicker than when they went in, if that makes sense.
Yeah. And I mean, one of the things I've heard, so Dr. Malani, for those of you who don't know, has worked with some really incredible clinicians and studying from them, learning from them. And one of the things I know that you said at one of the clinics that you did your residency at was just like, we're going to build you back stronger.
Mm-hmm. Yeah.
Right. Like, that's our goal. It's
Yeah.
not just like keep you afloat during treatment. It's like, no, how do we make you the healthiest we can be in every step of this process?
Yeah. 100%.
And not, yes. And that is the attitude I want you guys to have at home. Like, I want you to, if you're feeling defeated, don't, right? You can come out post-cancer stronger than when you went in a lot of ways, nutritionally, lifestyle, right? Like, and that's what this is about too. For the folks at home who are thinking, God, I wish my loved one would be interested in this, but I'm not sure that they're going to sign up. Dr. Anna and I have the experience of, we meet with people who maybe like their husband has just been diagnosed. The husband is kind of overwhelmed. He's like, I'm not ready to meet with any other doctors yet. Right. We will have our client talk to Dr. Malani and say, hey, this is what my partner is going through.
Yeah.
What does the evidence say that I can be doing at home with our food, with the teas that we're drinking, with the supplements we can talk with his team about? Like, if you are someone and your loved one has cancer, you deserve support as well. And everything you're doing in your household can really make a difference with their treatment and recovery. And also, it will let you feel powerful, and because you are, and really give you the tools that you need to be a really great teammate. So I want to give the two of you one last chance before we wrap up, and we will have way more conversations about this, because Dr. Malani, I just like need more of you in everyone's life. And Dr. Anna, same thing. This is why we film something every week. But yeah, can you guys, is there anything else you want to chat about or leave people with?
I'll just say, your point of building the patients back stronger is so crucial. And I think the reason I love doing what I do is that moment where the patient realizes that their illness can be an opportunity, and it can be an opportunity to change their entire life. It is incredibly challenging to go through a cancer diagnosis, but it can also be incredibly enlightening. And, I just saw a patient earlier who was telling me how this diagnosis helped her build boundaries with her in-laws and her husband and her children, because she had just been giving so much. She's a breast cancer patient, has been giving so much of herself to everyone. And she goes, this is the only time that I've had in the last 10 years where I've gotten to take care of myself and actually think, well, what do I need in this moment? And I just think that is such a beautiful and brilliant journey to be a part of. So that's really what I love, being there for my patients for, is just helping them recognize that they can take care of themselves and that they can come back from this stronger, and that this doesn't have to be, it doesn't have to be defeating at all. It really doesn't. So yeah, that's kind of what I have to say.
And I was going to add one thing also. So I've had the pleasure of working with Dr. Malani in clinic when we were in med school, and then also briefly at the clinic where she did her residency. And just the way that she interacts with patients and also their caregivers, and supports everyone in their time of need, and just sits with you as an individual, not as a diagnosis. She sees you as a whole person. So she is seriously the best of the best. I have sent so many patients to her, including very close family members and family friends who are really important to me. So she's the best. She's the one you have to see. Seriously, make an appointment with her.
I appreciate my cheerleaders over here. Yes. Well, thank you.
Yeah, it's us and the entire naturopathic community. So Dr. Malani, like she truly is the best. Please tell everyone, Dr. Malani, so how do they get in touch with you? How do they get started?
Okay, so if you are located in Washington State, I have a practice there. It's called Ames Institute. Anywhere else in the country or worldwide, go to drmalani.com. That's drmalani.com. I'm sure Dr. Kate will link it. And there should be a book appointment, and you can book an appointment with me right there.
Amazing. And guys, you can do a discovery call. So if you're kind of not sure or you want to talk to Dr. Malani about like, is this the best thing for me? Start with a discovery call, because what I know about Dr. Malani is if it's not the best fit, she's going to tell you and then link you up with the person who is, or the resource that is.
Yeah.
We're all about what's going to work for you. So please, at a minimum, do the discovery call. Don't think, just book it, do it. You'll be so, so happy that you did. So thank you, Dr. Malani, for coming on with us today. Dr. Anna, amazing to see you as always. I love working with you every day. We will be back, guys, with another episode. And if you have more questions for Dr. Malani, please write into us and we'll bring her back to answer them for you. Thanks so much.
Thank you both.